Okay, so welcome to our podcast. This is a little bit different today because this podcast is a spin-off of our radio show. This is the Doctor and the DJ podcast. And our guest today, well, here we have Dr. Carrie Bordinko, and I'm Johnjay Van Es. She's the doctor, I'm the DJ.
Not the other way around.
You run, what would you call Benicera? Wellness clinic, wellness center?
Wellness center.
Wellness center.
An amazing center.
And I have a radio show. That's the DJ part. And Dr. Rafael Gonzalez is here. El mero chingón de la playa is what I called you earlier. Behind.
I didn't know about that one.
I thought maybe that could be the way you get introduced from now on. But, right, Carrie, we wanted him to come here because there's all this stuff about stem cells.
Yes.
In the world. It's
we
everywhere.
were so excited to get Dr. Gonzalez on the show because we've had him on a show before when we did a podcast for you.
Yeah, for my radio show, and it took off. It's humongous. It's on YouTube, and on the radio show, you can podcast it, download it on Apple and iHeartRadio. I think one of the first things I like to get into, which I find so difficult to explain, because Carrie and I have been to the clinic to ReHealth in Cancun several times, had stem cells and NK cells. And when I tell people that in the United States, I can't seem to have the proper dumbed down explanation for why stem cells at ReHealth are different than the stem cells you can get here in the United States. I don't know how to answer that.
Well, first off, you can't answer it in 15 seconds. And most
Right.
people want a 15-second
Right.
soundbite about it. And, honestly, you have to capture their attention for about 30 minutes and say, I need to give you a level of education.
So there isn't an elevated response.
There is not an elevator response to this.
But actually, I think that there is somewhat of an elevator quick response. Is the correct stem cells and pure stem cells you cannot do here in the United States. It essentially is growing and purifying the stem cells that is not allowed to do in the United States, versus that term is very ambiguous with almost any tissue, cell. People are telling you they're giving you stem cells, and they're really not.
In the United States, they're
In the
telling you they're
United
giving you
States.
stem cells, but they're not.
But
How
wait a
does that
minute.
lead-
I want to interject. There are clinics in many states, and I'm just going to go with Arizona since we're in Arizona, that say they are able to give, and I'll quote, real stem cells like the kind you get in Mexico right here in Arizona. And I think that's the elevator speech John Jay's trying to go after, is how do you help people understand or vet? Because I want people to know how to ask the right questions to be their own advocate. So how do you give them the right questions to ask when they're sitting in front of a provider or a doctor at that clinic? Because unfortunately, a lot of those clinics are not run by doctors, which is interesting in itself. And so how can they, when they say, no, we do the same thing that ReHealth does down in Mexico, exact same product, how do you help them understand the difference?
Number one, impossible. And I would love to have a conversation with anybody that says that they actually do that. Number two, it's because of the methodology and years of research that we've actually done. Number two is I would tell for the regular individual out there, when you go somewhere and they tell you this, question one is, where are they from? Question two is, are they pure stem cells that you grew? Because anybody can take a piece of, is this what they actually do in the States here? A piece of tissue, whether it's amniotic tissue, whether it's placental tissue, whether it's umbilical cord tissue, and I'm not kidding you, this stuff goes into a blender. It's called the homogenizer.
That sounds
it's a
disgusting.
Blender. It goes into a blender, yeah, is what it does. It disrupts all the tissue bonds. They get a puree of it. Then they may sort out and filter out some of the little tiny tissues and this kind of stuff. And there may be some cells there. But that process is so rough on tissue. Think of the umbilical cord, you're breaking up a rope. It's essentially a rope. Or just tissue and ready. That it causes these enzymes in the body that are released. These are DNases. There's other ones too that cause cells to die. So when you freeze the product, you would freeze it. And then when you thaw it, because of the vitrification process or the process that happens when you thaw something, the cells just basically explode. Mm-hmm. Now, there may be some factors in there that have regenerative properties, but technically speaking, there's no real cells. That is something that's sort of called, in the law's eyes in the United States, like a homologous use, meaning the same intended use of it, or point of care, where they're actually doing it right there on the spot, taking a tissue, breaking it up, then infusing it into. But normally that's done in the context of, I extract bone marrow from you, I extract fat from you, I do a quick centrifugation, I isolate, and I put back into you that same day.
Your own stem cells.
Your own stem cell.
Right.
Now, even those are, once again, 0.00001% stem cells. It's like, I've talked about this many times, fishing in a sea of barracuda that has 1 million barracuda and you're catching one tuna. There's one tuna in there. That's essentially what you're getting. There might be regenerative factors in there. It might be beneficial, but it's not a true stem cell. That's one. Two, in the United States, you are not allowed to IV any of this stuff.
Wow.
That's the biggest difference too.
Like when we go to your clinic, we get the IV.
You get an IV.
200 million
You will
stem
get
cells.
correct. You will get pure stem cells that have been culture expanded, have been tested. One of the biggest issues here in the United States is the testing that's done on these types of disrupted tissues that are there that they call stem cells, because the initial tissue had stem cells. They believe they can call it, this is stem cells, but it really isn't. And then for me, being in this sector for over 20 years, it's bothersome. And it sort of hurts the industry because everybody now has jumping on to try to sell this stuff, to try to tell you that it's going to cure everything. Yet it doesn't. It doesn't matter who you are. A ton of people, yeah, I've had stem cells. It didn't do anything for me. Well, guess what? Maybe it didn't do anything for you because number one is it wasn't right, the correct amount of stem cells. Number two, the protocol, the method of actually doing it wasn't the correct method for that patient, because every one of us here is different. Sometimes you just do a straight IV of maybe 100 million cells, then 200 million cells. The protocol for an autoimmune disease patient is going to be completely different than the protocol for a longevity patient, then is going to be probably different than the protocol for a pulmonary fibrosis patient. It's all different because it's individualized when it's done the correct way for that disease.
So there's no one size fits all,
There's no one size fits all.
and there are no versions of real stem cells that get the clinical outcomes that some of us have seen the studies. I mean, there is real healing that comes through stem cells.
Yes.
The problem is in the US, once again, not getting the real stem cell, you cannot extrapolate that to mean I'm going to heal this process. But if they went out of country, then that is a real opportunity. So that's when they go to ReHealth.
Yes.
So, but the stem cells at ReHealth are from where?
They're from umbilical cord lining. It's a specific methodology that we published back in 2010. We've actually, our U.S. entity, licensed the technology to the people in Mexico.
And the stem cells in the United States, they're not from the placenta, or they're not from
Absolutely.
the umbilical cord. They're from the placenta, most likely, right?
The ones that, it depends. I've seen ones from amniotic, for instance, amniotic fluid, you'll see that a lot out there
Right,
now.
right.
Essentially, a mom has baby, they do an amniocentesis, or they'll do a puncture, they'll obtain 100, 200 mLs of fluid from there, and then they'll basically filter this, freeze it immediately, and say, here's stem cells.
Okay.
When it's not stem cells, it's the percentage of stem cells is really, really low. In that fluid is going to be a bunch of antibodies. There's going to be epithelial cells, other cell types in there, because the amnion is also, same as the placenta, is loaded with filter cells, which are epithelial cells.
Let's get into the miracle of the real stem cells that you have. What have you seen? What miracles have you seen from people, or just great stories of people getting your stem cells from Cancun, from ReHealth, and what's happened? Because I've heard stories.
Yeah, I haven't. I mean, well, you've seen stories,
Right. I've been
I
a
haven't-
part
We've seen
of
them
it.
firsthand.
Yeah,
We've
yeah,
been
you've
part
seen-
of them.
You've seen
Yeah.
them firsthand. I don't call them miracles because they're sort of a transformation of a quality of life. A miracle is somebody that couldn't walk that stands up and then starts walking. That'll never be the case of somebody in the context of a spinal cord injury.
Okay.
But if you look at, for instance, that's one of my specialties is spinal cord injury. If you look at the context of an individual that's in a wheelchair, they're really not looking to stand up and walk again. They're looking at their quality of life of, how do I improve my bladder function, which is things that we take for granted on a daily basis. How do I improve, believe it or not, there was a survey done on over 1,000 patients. How do I improve my sexual function? Because that's out the door, once you have a spinal cord injury. So they look at those two things as key, dictators of improving their quality of life. That's what we see with the sort of the baby steps is I improve bladder function. I've improved, basically sexual function. Other ones that you guys have both seen before, patient comes in with an ejection fraction of 19, 20, and you're talking about somebody that's relatively exhausted, can't walk a block,
Well, we had a case where we sent you a patient with an EF of 12 or ejection fraction of 12%.
Okay, wait.
Yeah.
And I remember the clinic telling me, no, Dr. Bordenko, you cannot send this patient down here. He's not stable enough.
But wait, what is an ejection fracture?
An ejection fraction
Fraction,
is the
see?
amount of, it's a percentage of the amount of blood that your heart pumps out with each beat. So to know what 12 means, you have to know what normal means. So normal is around 60%.
Okay.
So 12 is pretty compromised. 10 is transplant.
Okay.
So that gives you your scale.
Okay, and then so the story you were talking about, the person,
Yes.
he had a 12.
So
He had a 12 and
So
he
you've
was
done- yeah.
denied transplant. Yes.
Yeah, so you've done treadmill tests, right?
The what?
You've done a treadmill test with a
Oh, treadmill
cardiologist.
tests. Yeah, yeah.
Treadmill. So they probably told you, don't worry about it, you're perfectly fine. That means you're in that range that she talked about. You're in the
That's
60%.
60%.
Yeah.
Oh, yeah,
The
okay.
60%
They wait
range.
till you
I've
get
done one before,
for like
perfectly fine.
12 minutes, 11, 12 minutes, something like that. You get on the treadmill, right? Okay.
Yeah,
They
depend.
hook you
Yeah,
up with all the
yeah.
electrodes.
So you're perfectly fine. So
Right.
just imagine that being essentially a quarter of what it should actually be. Now, there's not enough blood circulating in the body, hence a tremendous amount of lowering of oxygen, because ultimately oxygen is life in the body. You know, oxygenating the brain, oxygenating the limbs, the outer limbs, everything. So now you've depleted that significantly. So think of the individual that just getting up, right? Just getting up, they're tired.
Just walking to the bathroom.
Yeah, just walk into the bathroom. They're tired. You'll see individuals that look pale. They don't look well. It's that type of individual. Now, just imagine if you took that person and you've now improved his outcome by we're talking about improving the outcome by about 20%, 30%. They are now into that case went into, I think, 29.
We actually just looked at that case yesterday with cardiology, and he's at 30% right now.
Wow.
But this is now a person that probably, I don't know
Who
exactly.
worked out in the gym today.
I saw him today.
You did.
I saw somebody else that you know, he loved playing golf, had to stop playing golf. This guy described having a hard time tying his shoelaces, like just doing that. And then all of a sudden went within days of having this done to being able to tie the shoelaces, to starting to play a small amount of golf, and then building upon that. And we describe building upon that. We describe things that, you know, Dr. Bordenko does is, you know, let's make a little bit of a lifestyle. You're making a sacrifice in your health, make a sacrifice on yourself, invest in yourself, eating right, exercising, all of that comes into play when you're doing this the right way.
Yeah, you can't just get the stem cells and then go back to the way you were living. You've got to take care of them.
Take care of them. Take care of yourself.
What
I mean,
about the average healthy person? If they get this treatment at ReHealth in Cancun, like how does it? Because we were talking about injection fracture, a 12 or a 13.
somebody that's sick.
Yeah. What if you're at 60?
Yeah, what if you're normal?
Yeah. What if you're normal?
What if you're normal? So this is what we've seen in the context of, for instance, fighters, UFC guys, is those individuals describe, number one, the majority of them come to you because of pain, joint issues, a lot of them, of course, back issues. What we're seeing is two things. What we know based on studies is what the cells do. The cells that we use, we know they can help control the inflammatory response. And it does this by changing your normal active pro-inflammatory response to what's called the regulatory response. That regulates the immune system. So now we dampen the pro-inflammatory response. When you think of pain, you think of inflammation. So it's a natural response that transpires on any given day that has to transpire. The only way you heal is if that inflammatory response is elevated quickly, then you get what's called an anti-inflammatory response that comes in and does the healing. What happens to us as we get older, unfortunately, is we have a dampened immune response. It's a really dampened pro-inflammatory response that takes a really long time, and then you don't get the same type of healing response, that anti-inflammatory healing response. That's also dampened. Think of when you were a kid, when, you know, I think we've talked about this before, you fell down your skateboard, you started crying right away, you're in a ton of pain because you wiped out so bad. What happens? When's the last time you wiped out?
On a skateboard? I can
Not
tell you
on a
exactly. No,
skateboard.
I can tell you, a skateboard 10 years ago was terrible. I broke my wrist. It was terrible.
But did you ever think of when it happened, you know, even though it was 10 years ago, when it happened, how much pain were you actually in versus when you were a kid and you fell down and you screamed and cried because the pain was exponentially higher.
Probably more pain when I was a kid, right?
When
As an
you were a
adult, it's
kid.
less.
And it's because that inflammatory response is dulled. That's another reason why, which we can talk about PRP after, is the reason why PRP came into fruition is it causes a really strong pro-inflammatory response, platelet-rich plasma, and then hence it forces a really strong anti-inflammatory response.
Okay.
So you get a quicker healing response,
Right.
with it. That's the concept behind it. So the cells that we use help control the inflammatory response. That's one. Two is we have evidence that it releases a specific growth factor that increases blood flow. There's probably nothing more important than that, because when we discuss that, we talk about oxygenation to vital organs. There's a ton of studies that actually show, for instance, individuals that have peripheral artery disease. It's essentially, think of a stroke or a heart attack of a limb, where there's an occlusion in an area. And now, normally, the body's response would be to form what's called anastomosis or bridging, meaning new trees, new vasculature grows around it to try to bridge that gap. When you use stem cells, there's evidence that you can bridge that gap. But what does that mean is essentially I'm causing more increased blood flow. For those of us that are worried about our heart, worried about heart conditions, worried
Our
about
brain.
blockages, our brain, all of that, you need that. That's sort of like a natural response. But as you age, that response is dampened significantly, that the body finds ways to naturally heal itself. This is another method of helping the body naturally heal itself.
So if you are a typical person and you get these stem cells, the stem cells you're talking about from Cancun, from ReHealth, how do you feel? Like for me, I feel like I'm operating at a different level, but I can't explain it properly. So I don't know if there's a medical explanation for that.
I think we have a medical speak between all of us who've done it
right.
because we actually understand
Yeah,
what we're
can you-
trying to say, and there's no words for it
Yes.
to explain it. I've used different things like you. When I told you the very first time I came back, I said I felt like I was defying gravity.
Yes.
And I
right.
didn't know how else to say it until you experienced it. And you're like, I get it.
I get
The
it.
weight of the world is not pushing down on you
Yeah.
anymore.
And I feel sometimes that I'm like, man, what if I didn't get these stem cells?
I know, that's
'cause-
the scary
you know
part,
what I mean?
right?
Like,
That's the fear factor.
Yeah, I think, like, for instance, in the context of, and you guys have described this too, is what I've seen is, for instance, performance. The performance will go to another level. And it makes sense because you've dampened that inflammatory response and you've increased blood to the vital organs. So what we've consistently seen in individuals that the fighters, the UFC fighters, this kind of stuff, is that a lot of them will describe, my VersaClimber, the timing of it, I'm doing it much harder, much faster.
Right.
My time between rounds, recovery time between rounds is shorter. So I'm ready to go quicker. And this is what you see. And going back to the gentleman that I told you earlier that, couldn't tie his shoes, the craziest thing about it, and if you think of this gentleman talked about, you guys have changed my life. I'm playing golf again. But the interesting thing is I'm 65 years old. I haven't had sex in 5 years. And I woke up with a spontaneous erection this morning. This was like a week after. And this gentleman told me that. And he's like, and if I just had to do it for that, I would be the happiest man in the planet. Because think of the penis, it's blood flow to the penis,
Right.
is what it is for this to transpire.
I'm a big
It
fan of the
increases.
spontaneous erections.
We all are at our age. Yes.
Sounds like the name of a band. Next on stage, spontaneous
So-
erection.
So I think it is challenging to try and tell someone what to anticipate. And I always tell people, don't anticipate anything. Go for the journey. Because I think all of us walk away with something different when we do this. We don't know necessarily where the weak link is in the armor. And it does seem to try and find its way into that area sometimes. So you don't know if recovery is going to be better. You're going to be able to do more training, less recovery between workouts, or lift better, or, anything like that. Some people notice their skin changes. Some people notice their hair changes. I've had guys come back and go, I've done Propecia and all these hair treatments for years and nothing worked. And now all of a sudden I'm getting more hair back. What's going on there? So it's such a variety of how you can benefit. But one of the things I want to ask is, you talked about increased blood flow. You talked about some of the conditions that it helps. We didn't really line those out. But what about people who can't go? Is there a type of individual that this would not be positive for? I'm thinking kind of along the lines of cancer.
You absolutely cancer. People have had a previous history of cancer because the problem is you might ignite something that you don't want to. You don't want to increase blood flow. If you look at cancer, cancer is something that consumes all your nutrients. You know, it's that cell that basically needs the nutrients, consumes the nutrients, especially you look at tumors, you look at, the shape of tumors. If you've seen biopsy tumors, they're loaded with, vasculature around them to consume all the energy, all the nutrients. So you'd avoid that. That's one. Somebody that's immunosuppressed, we'd be cautious with because there's a concern. Somebody that's had a ton of trouble with a lot of viruses, we'd be concerned because it's a challenged immune system. We don't want to, we'd have to be really, really cautious. And we talk about doing something different, possibly like NK cells, natural killer cells.
And that's where I was kind of going with this. So stem cells aren't the be all for everything.
No, absolutely
But
not.
there are other solutions down in Cancun. If you're the person who stem cells aren't right for, then there's something called NK cells.
Natural killer
Johnjay's
cells.
done NKs. I have not yet. But can you give us more? That's something you don't hear touted around clinics in the U.S., so they don't seem to be trying to promote that.
Yeah.
What is an NK cell? Why would we want to think about an NK? Obviously, cancer and immune suppressed, we just kind of talked about, might be the perfect candidates.
Yeah, so you look at natural killer cells, it's part of what's called the innate response or the initial response in your body. You walk around with anywhere from about 1 to 2 billion of them on a daily basis. They turn over around every 28 days. They age, turn over, your bone marrow has to naturally produce them again. And they're in charge of 3 things in your body. They're in charge of a mutated cell, the first responder to a mutated cell, the first responder to a virus, and then they're a first responder to what we focus on, which is a senescent cell. It's a zombie cell. A lot of people hearing that term now, zombie cell now, a lot more, because there's a significant amount of evidence that this senescence, it's essentially a cell that has only a finite amount of divisions. Every cell in your body only divides a certain amount of times. It's done dividing, you're old. This is what causes a neurodegenerative disease. This is what causes cardiovascular disease. And now there's evidence that originally it was thought that that's the natural mechanism in your body to stop proliferation of cancer. But now there's evidence actually to the contrary, that these senescent cells, these age cells that just occupy space, they release havoc and release factors that can cause mutations and cause cancer. So this is what our focus is to remove those age-old cells. We published a paper at the end of 2022 looking at specifically at removal of these zombie cells, and we showed clear evidence, relatively clear evidence, that you can, small patient group, need larger studies, but showing that we can remove this senescence from your immune system. So what does that mean? You removed, the senescence, these old zombie cells from the body. You've now forced the body to do some form of a healing response. The signal's there. Remember, the body walks around with a certain amount of cells on a regular basis. Every single day, you turn over about 330 billion naturally, which is pretty crazy. Think about this, 330 billion cells turn over in your body every single day. Mostly red blood cells, but the other majority of them are cells that are proliferate a lot. And there has to be a homeostasis or a balance on a consistent basis. So if you lose cells, you have to gain new cells back. And the other thing, like for instance, we know if the signaling cues are not there to basically to make that change, there is no change. Simple example of this is, and there's articles, scientific articles on this, heart failure patients. Heart failure patients, believe it or not, walk around with more circulating stem cells than somebody that's relatively healthy. And if you think about that, what is that? The body's trying to heal something, but the signal is not there. The correct signal's not there. Maybe if you remove something or did something different, then those stem cells can naturally heal.
Wait, so the NK cells then? I'm just trying to understand and translate this back.
Yes.
So the NK cells, you put them in, and they essentially eat or get rid of the zombie
The
cells.
zombies. Yeah.
So that just leaves good cells.
That makes your own body produce brand new good cells.
But then when you
Young
get the
cells.
NK cells put in your body, they only last 28 days, the new ones?
The new ones last up to 28 days based on what we know. But what they're doing is removing, and the same thing as a stem cell. Everybody thinks the stem cell will regenerate an organ, will be there, will change into a particular cell type. It does not do that. There's a significant amount of evidence that that's not what it does. For instance, you do an IV of, let's talk about stem cells or NK cells. NK cells are smaller than stem cells, so they can go into circulation a lot better. But a stem cell, a good stem cell, is probably in the range of about 11 to 15 microns. An older stem cell, if I pulled a stem cell from either one of us three and I start growing this up, our stem cells would probably be in the 16 to 20 micron range. It's almost double the size of these smaller, younger, naive ones that are a lot more potent, release a lot more of the right factors, do that. Those, when you do an IV, as soon as you put an IV into an arm, the first spot is the lungs. Immediately. Circulation goes almost 200 miles an hour, immediately to the lungs. They get trapped in the lungs. They're trapped in the lungs, and what transpires, just like every cell in your body on a daily basis, is saying, I want to survive, I don't want to die. Same exact concept as when you fast. It's a different conversation. But it's the same exact concept. So your body, your cells say, I don't want to die, I don't want to, nobody wants to die. Believe it or not, the cells in your body do not want to die. So what do is they try to basically understand the niche, the area that they're in, and they basically start communicating with each other, which transpires in every cell in your body. They communicate with each other by releasing factors that are necessary in that environment. Then those factors are much smaller, a fraction of the size. These are growth factors. These are exosomes, these bioactive nanoparticles that can now circulate in the system and make a change in whatever, let's say in your lungs, in your heart, in your vasculature. Make that change by releasing that factor. Simple thing is, think of what we talked about, the heart failure. How is it that you do this and you've increased blood flow? Well, the most likely explanation, and based on studies, is you've increased this growth factor called vascular endothelial growth factor that now binds the lining of a vessel that causes sprouting of new vasculature to transpire. Without that signal, it wouldn't happen. It's not necessarily the cell per se itself that's changing. It's the factors that were released that causes a change in your own body. So you're essentially, endogenously, your body's healing itself with the help of
But
the
for
cells.
28 days.
In the context of NK, no, because once you've made a change, you made a change, relatively long-term change.
Okay, but the cells are out of your body in 28 days.
The NK cells are out of they're pretty much removed,
But
eliminated.
they did the work.
They did the work, and then they're gone.
And so how often do you
The
recommend
stem
getting
cell, the same thing.
But how often should you get NK cells?
NK cells, based on the studies that we've done, is anywhere from 6 months to a year. If you do it more frequently, and you'll look at the studies we did when we did a repeat cohort, it lasts longer. So meaning those zombie cells are removed for a longer period of time.
But if somebody got stem cells, if they go to Cancun to ReHealth and they get stem cells, they're like, I only need to do this one time for the next 10 years, I'm good.
Probably not.
No.
No.
They'll
This is
probably
a
feel
lifestyle
better.
change.
I mean, it's got to be
You will-
sort of like...
You will have an improvement, and normally people describe the first treatment having a much larger improvement than the sequential treatments, but it depends on how far out you go in between treatments. It just depends. But it's like you have a headache and you take a Tylenol, and that initial response is relatively profound. If you're somebody that takes a Tylenol because you have a headache every single day, it's not going to be as effective. That's one. Two is, we talk about regularly, is you better make a change. You better make a change in your
We're talking about lifestyle changes.
Yeah, you better make those changes. Otherwise, that's why the difference with us too is, if you're a patient that comes to me with pulmonary fibrosis or discusses with us pulmonary fibrosis, COPD, any form of lung issues, and you're smoking and you're not willing to quit smoking, I don't care how much money you have, do not waste our time, do not waste our effort. There's a lifestyle change that needs to happen there. And that happens straight across the board. It's individuals that quite don't understand autoimmune diseases are on the rise. Granted, the immune system is challenged on a daily basis, and I talk about this a lot. And if you're not looking at the key little things that you're doing daily, your diet, which is number one, supplementation you're taking, exercise regimen, are you doing it the right way? Is it specific for you? You're not going to help yourself.
I know
It's not
a
going to
guy.
last as long.
I met a guy actually at her clinic, and we talked about this a while ago, him and I. And then I talked to his wife about it just last week, that he had some heart problems because of COVID, and he went to get stem cells, and fixed it. Like,
Yeah, I mean,
Like that.
with COVID, there's been documented myocarditis, pericarditis, which are inflammation of areas around the tissues of the heart.
oh, so the stem cells get rid of inflammation.
And so it's addressing the inflammatory response. So when you think about it, I mean, all we do in traditional medicine is throw steroids at it because that's the only thing we have. Maybe even long-term steroids at cases like that. So taking a much more, I'm going to call stem cells a natural approach because I really do think of it more that way, to addressing that inflammatory response that happened around the heart because of a virus. Yeah, it has great outcomes.
Yeah, I mean, we have individuals that have been on your standard autoimmune patients. We know it works well in autoimmune diseases. That have been your standard medications that are out there that you're seeing commercials on, crazy, that suppress your
Your
entire
TNF
immune
alphas,
system.
that run
Yep.
secondary risks
Yep.
associated with them.
Yeah, crazy amount of secondary risk with them. That we know that we can regulate the immune system and we get the outcome that we're expecting, including individuals that have been on steroids and these anti-TNF alphas, and we get them off of everything.
My friend, who I took, you met him, both of you met him, Mr. On, and he said I could talk about him. Game changer with his life. The guy has a whole different. He's been twice now.
And remind everybody how old Mr.
I think
On is.
I think he just turned 80.
Yeah.
And he had chronic back pain for 15 years. The last 5 years was, I mean, he couldn't even walk. And he told me he was going to go have back surgery. And I said, wait, come with me to Cancun, come with me to ReHealth. And he I'll never forget this. It was like, he did the stem cells that night, had a rough night. And the next day he was like a 15-year-old ballerina, right? And then here we are 2 years later and he's the same. Like he is like a 15-year-old ballerina. He's relaxed. He's got no pressure. He feels amazing. Every time I see him, he thanks me for introducing him to you guys.
They treat it with him. One of the other issues, for instance, here in the United States, if you're not treating the system, you're not doing it justice. Because anybody past 40 years of age is going to have some form of a strong inflammatory response. If you have a knee issue, you've got some form of osteoarthritis, which is a systemic issue that's direct targeting the specific joints. If you're not dealing with the system, then dealing with locally, you're doing yourself an injustice. If you're just going to get a stem cell, yes, you might get an improvement temporarily, but essentially you're going to go back relatively quickly to having an issue.
So you're saying injecting it directly into the joint or the back in Mr. On's case.
Mr. On's case, he got injections he got a systemic injection.
But he got, and systemic
and
meaning the IV
the
form
IV.
that goes throughout the entire body.
Yes.
And you say you have to really, it's a two-prong approach.
Yes.
You have to hit both sides of it.
You have to hit both sides of it. Yep. And he got many injections in his spine. And the concept behind that is simple. There is, people look at, for instance, you'll look at an MRI sometimes and somebody will say, I have no back pain. And I've seen these before. I have no back pain. And you'll look at that MRI and you're like, your back's destroyed.
All the time.
And then you've seen these too. And then you'll look at an individual that tells you, oh my God, I can barely walk and I'm in pain. The facet's a little off.
It's a fairly normal scan.
Yeah. And you don't see that much, but these guys are in a crazy amount of pain. But then you try to target just one thing in the spine. And it's actually, if you think of it, it's the wrong approach. Because fixing just a herniated disc, when that disc has been compromised for a long time, you've now thrown all the ligaments out of whack in the area, and there's a lot of them in that area. You've now thrown the facets, most likely, which is basically the shock absorbers on the side of the spine, out of whack too, and possibly causing degeneration of that. If you're not targeting the entire area, trying to help heal those tendons, heal those ligaments, heal that facet, without even touching that disc, you'll be surprised the benefit that you can do in a spine, which is what we've seen regularly.
What about for eyesight and hearing?
I haven't, anecdotally, I've heard a lot of people saying, hey, my eyesight's improved. I know, for instance, me personally, my eyesight has not gotten worse. It's actually gotten a little bit better throughout the years. But I'm more of the proactive of not using glasses. Nothing against optometrists.
Not even readers?
I have to sometimes so I don't get a headache. But otherwise, I avoid them because I think you weaken the eye.
Yeah, but that was something I noticed personally too. It's like I said, we don't get to pick what it fixes. And that was one of the things that I started using readers about 9 years ago. and I haven't used readers for the last 2 years or driving glasses. So I use both.
When you say you can't pick, essentially, if I was just to kind of dumb this down, like, not because you guys are like doctors and, big words, like if you get stem cells from ReHealth, they don't know what they are yet, right? So you put them in your body, and do they just kind of go places? They just kind of go, oh man, maybe go here, let me go here, let me figure, oh man, check this out, this heart's congested.
Remember one place. Like when we did our mice study, mostly the lungs. And then from the lungs, believe it or not, some were sequestered, meaning they traveled because they can smash and travel in between the vasculature. And then they've traveled, a lot of them in the mouse study showed that they traveled actually to the gonads, so the sexual organs. And then some of them actually traveled to the brain. Very, very few. But the interesting thing is there's a significant amount of evidence that inside the lung, there's a cell called a macrophage. It's part of that immediate immune response. A phage is a cell that basically eats, and it's a larger cell that eats mostly bacteria. It works directly with bacteria. That's why there's so many of them in the lungs, because there's a lot of bacteria in the lungs. And they are of the pro-inflammatory type. When these go into the lung, the stem cells go into the lung, those macrophages are in there. When the stem cells start to die, something has to remove it. Your immune system is in charge of clearing what you have inside of you. These macrophages now pick these up, and the macrophage changes from a pro-inflammatory one to a healing anti-inflammatory one. So here we go again with your own system sort of doing the correct response, doing the healing, doing everything that's needed.
How about hair growth?
I mean, I've heard anecdotally some people talk about, I wish it would work on me. It hasn't worked on me. But I think there's many things in play, with that. In the context of skin, what you just said, described straight across the board. People describe flushing, plumper skin, and it makes sense. I'm actually talking about that in 2 days, is basically the complex system of, the skin is actually a physical barrier. The skin is part of your immune system. And the skin, there's a ton of immune cells that are integrated right below that big, most important layer, which is a fibroblast, that forms the 3D matrix that we actually live in. So the immune system the skin is part of the immune system. And those that get this done look better, have less wrinkles, more plumping. They just look somewhat rejuvenated. I can't explain why. I can't really pinpoint it because we're not doing studies on skin. You can't really say.
That's the
it's
miracle.
most likely the increase of the blood flow, which makes sense. To
I
the
think
body.
it's the stem cells, and then now you want to take care of them, like we said, change your life.
It helps.
So you start getting like collagen in the skin. You start getting healthier. You start getting right.
Yep, and that's the other thing I was going to talk about, because people don't spend enough time discussing the one word that you just said is collagen. Collagen's, the collagen that's produced in the skin, which is collagen 1,3, is the most abundant protein in our body. It's basically, these cells produce this. It's a 3D somewhat that we live in. The second one, it's not a protein, but it's a proteoglycan, is hyaluronic acid. Hyaluronic acid is what you find in joints. It's what causes the lubrication in joints.
They're used in women's cosmetics everywhere.
A ton, yeah, and so is collagen. And these are basically the building blocks of everything cellular. The number one building blocks of everything cellular. But guess what? These cells produce it, especially in an umbilical cord. The umbilical cord, if you look at that thing, people talk about this Wharton's jelly. This Wharton's jelly is basically that rope-like, the inside of that rope-like structure that contains a particular stem cell, but most importantly, the structure that makes it hard is hyaluronic acid and collagen in nature. So the cells that are in there have to produce it to protect the vasculature that's in there.
Your shirt says Juvex-Q.
Juvexo.
Juvexo, okay. So what is Juvexo?
Fantastic question. Juvexo it's a topical cosmetic product that we've developed that is obtained from the stem cells that we actually use. It's a product that just you apply topically. It contains collagen, hyaluronic acid, naturally produced from the cells. We've sort of coerced the cells to secrete out what we want for the 3D matrix to help heal skin, help skin look better. So, and it contains these bioactive molecules called exosomes. Exosomes are basically 1/1000th the size of a cell. Every single cell in your body produces an exosome. So we talked about cancer earlier. Cancer cells produce cancer exosomes that cause more cancer. So every cell in the body. If you think of what transpires long-term communication in hormones, it's similar to an exosome where communication happens from, let's say the pituitary gland all the way down to the testes for testosterone, something, similar like that. It's a protective mechanism that a signal can get from one location to another location. And it's something bioactive. It can have lipids in it.
But your product is a cream?
It's a serum. It's a serum that we use in the context of following a non-invasive procedure like a microneedling, CO2 fracture laser, electroporation, any one of those devices where you do a little bit of, basically an injury to the skin to help healing. It helps heal quicker, and it helps basically the appearance of skin.
Yeah, because I did the microneedling.
Yeah.
And they cut up your head and everything. They rub the exosomes in your face.
Yep.
Right. And that's the serum you have. Like
Correct.
that. But why is yours different and better than the other
Mine
stuff?
is because we've actually forced the cells to secrete out high molecular weight HA, which is better than low molecular weight HA. And then also collagen is specifically for skin. It's not like you took this from, people talk about, the other thing we talk about is what's different from one stem cell to another stem cell is every baby is born differently. The ones that we have are from 3 donors, and that's it. The one that we use now is only from 1 donor that we reproduce these cells. We've done all the testing, all the genetic testing on it. We've done the age testing on it, how old they are. We know they're that of about 15 years of biological age. Everybody wants to have skin of 15 years of biological age. They're in that range, and they release the factors that are necessary for skin. We've basically fed them a specific way. It's funny because one of my colleagues described, he's like, wow, that's sort of crazy what you do, is because what you guys are doing, and you guys should change your name to the Hormetic Company.
Hormetic?
And I don't know, the Hormetic or the Hormesis Company. I don't know if you guys know what Hormesis is,
Hormesis,
basically.
yeah.
Yeah.
I know what Hormel is. Hormel chili.
So Hormesis is, and you do this actually, Johnjay, daily, is when you basically cause a physical stress in your body to cause a positive response. Why do you get into your infrared sauna, or why do you do a cold plunge daily?
Because I heard it's good for you, and the people I trust, like her, say do it. So
And you feel better.
I do feel better.
So-
immediately, actually, with the cold plunge.
Well, yeah, it wakes you the hell up. That's for sure. One of the hardest.
By the way, I
things
feel like
to
I was way ahead of the cold plunge game. I was doing cold plunges in 2007, right?
That's
and
true.
Now it's everywhere.
Now
So
it is
I feel way
everywhere.
ahead, and I feel that way with stem cells too. Because stem cells, we started doing when I first went to do stem cells with her at your place 2 years ago. I kind of was hearing about it. Now it's just everywhere. People are talking about it,
Yeah.
but they don't. There's no answers. By the way, where do you get the Juvexo?
We have it's a company in Miami, out of Miami. That's
But
also
if someone's watching this, they're like, I want to get that serum. Can the normal person
direct
get
to
it?
consumer, no, it's only direct to physician.
Oh,
So
really?
physicians, you'd have to go and say, hey, I want you to use Juvexo.
But
for
why
a
would someone need
procedure.
it? Their skin, acne, breakout?
Yeah, if they want to do enhancement of the skin, help appearance, they would just go to, the doctor uses it in conjunction with other thing modalities, like we said, electroporation, anything that can help open up the pores that can penetrate it, or trauma or anything like that can penetrate into the skin.
By the way, you were on Gary Brecka's podcast not that long ago, and I just want to say that we had you on our podcast way before he did. So I want someone to go, oh, that's the guy who was on Gary Brecka's podcast. True,
No,
but we
he was
had you
on
before
ours.
that a long
Way,
time ago.
yes.
Can we bring Carly? Can you come up here? Can you say, my friend Carly Klein is here. 'Cause
I have been wanting to meet you for a very long time,
We
so it's
both
so great
run
to finally.
so busy. Yes, I know. We have to do a podcast to meet.
Yes,
It's wonderful.
I know.
Yes, I've been trying for a long time because she's got the hyperbaric chambers, right? You got people doing hair transplants and doing other things and alopecia and stuff, and it's like you could send people to her.
Yeah.
She's got people that want to do the exosomes or whatever in the skull, right?
Yeah.
You can send them to you and you. So
Yeah.
there, I just wanted to make this connection, talk to Carly
Great
about
connection.
It's a great connection. No, I love it. And, we've been working with stem cells, PRP, spinning it down multiple times. But what we do is we try to figure out, what does it do? Obviously, we know when it works for the skin, what can we do for the hair?
Right.
So then we do clinicals to see microscopically how that inflammation is going down. We do a lot of epigenetic testing now because we know so much is coming through the diet, the gut, like you were just saying. When I started in hair loss almost 20 years ago, my average age was 55 and older. Now it's 12 to 40.
Wow.
So
That's
What?
insane.
Wow, that's crazy. 12
Because
years old?
lifestyles have changed.
it has.
Too
Like,
many
what is that,
too many
cell
Cheez-Its
phones?
or what?
No,
Or is it too many
actually,
Cheez-Its?
it's crazy because we were talking about even reproductive.
Mm-hmm.
You know, what are kids growing up with in their lap? An iPad, an iPhone from the time that they're
And
a
McDonald's.
baby. Yes.
EMFs.
Yeah.
And so you've got the EMF factor. You have the foods that they're eating is processed.
All processed.
Everything.
100%.
Yeah. So now their immune system is so depleted by the time that they're graduating high school. What they would have had later in life with androgenetic alopecia, they're getting much earlier and much more aggressive. So we're trying to look at the root cause, not the symptoms. So what is all the areas that we're getting the inflammation? And then we're trying to combat it on topically while we're working on what's going on in the system.
Yeah. Like you said, you got to address the system first.
Yeah, you absolutely have to address the system. And then the gut thing is huge. I mean, I talk about this regularly, is if you don't have this right, if you don't have the gut right, you cannot have even your brain right.
Right?
can't- yeah,
A gut
I mean,
feeling, right? That's
yeah,
where a
yeah,
gut feeling
yeah.
comes
So how do you get
Yeah,
your gut
yeah.
right? What do you need for?
You got to eat. You got to find. It's different. Everybody, you know, like for instance, I've been asked, well, what diet do you follow? I said, listen, I don't. You know, I'm different than you,
Yes.
than you, than you.
Right.
Vegan may work for you. Vegetarian may work for somebody else. I practice just basically stress on a regular basis. I may do a 24-hour fast. I may do a fast mimicking diet. I may just go keto for 3-4 days. I try to change it up. I know no matter what, somewhere along the line, it doesn't matter. The math is the math. You got to caloric restrict. The only thing that's been
Right.
proven for longevity is caloric restriction.
Well, you'll do a 24-hour fast, just water.
I did 72 hours just recently.
You did that.
It sucked.
Yeah, is that the one where you
Yeah.
have the bone marrow? You drink the bone marrow.
I drank the first day. We drank
Bone broth.
We drank
Bone
bone
broth,
broth.
yeah,
the
bone
first
broth.
day. It was hard.
So was there any benefit to it?
I mean, I felt great day 3.
They say you get a lot of energy from it on day 3.
After the day 3,
Yeah,
correct.
But is
around
that
there.
so
But
that
it was rough?
the fast eats bad cells? That
The process called autophagy, when essentially, like we just said, cells can't divide. There's no energy. Where are we going to pick up the energy? The bad stuff is being released. It's being released, and then your own cells have to pick it up for food, for energy. And that's called autophagy.
But I mean, I want to go. You said you touched on this, and I really want to drive this one home. I get the same question all the time. What's the perfect diet? What should I be eating? And I go, wait, stop. Here's the problem with everything out there is if it's successful for one person, you assume it will be successful for you. And that's not reality. We are all different genetic creatures. So I always say, experiment with a few different ones. Keep good tracking of how you feel, what changes. Does your blood chemistry change? You know, are you borderline diabetic? Do you have high cholesterol, dyslipidemia? Are those things improving? Look at that. And then whatever resonates with you, whatever you feel best on, stay with it. The thing is, don't hop around between diets. That's where people get in trouble.
that's where you saved me, actually.
Yeah. I mean,
Because I was on every diet, and then she was like 2 years ago, do this.
Well, you found the right one that's good
Right.
for you.
Right.
and that's
right.
just it.
What
And we
you-
may be completely different on the
Yeah.
spectrums. You know, fasting does not work for me. Fasting does not work for some females. They put a
Yeah.
lot of body fat on and they eat up their muscle. So it's the opposite direction we
Yeah.
want to go. It works phenomenal for men. They put on muscle and eat up fat. I do not know why. But it's true. And so women tend to do better with eating small, high protein meals more frequently throughout the day. It helps with their hormone stability because I think we do have slightly more hormone issues than the men do. So, I think that once again, you've got to go back to figuring out what your gut feeling is and
Yeah.
your gut health is. Get that stabilized, then go explore a lot of other things that you can do for your body.
But when you did a 72-hour
3
fast,
day.
when
And
you
the weird thing about it, Johnny, was after I did this and I started thinking about this, I mean, I'm a scientist, and I said, I don't agree with this. Because you start thinking of the process that transpires at probably day 2, I was going into muscle.
right,
And
right.
when you're
Yes.
50, I'm 58 years old. When you're 58
You
years
can't
old,
afford that.
You can't afford exactly.
Okay,
because
so
it's
it's
hard
not
to
good for
build.
you.
So I can't see that. I can see a 24-hour fast where you're cleansing and you're cleaning, and you're not because you're going to tap fat, but you're not going to tap muscle. But I started thinking about this, and I remember the second day, I was like jittery as jittery can be. It was difficult, taking some magnesium, trying to find some different supplements to get through it. But I started thinking about it. I was like, wait a second, I got to be at some point where I'm burning muscle. And then there's people talking about, which is even crazier, you can go work out. I'm like, you're crazy. I went to the gym with my son the second night. I I was like 120 pounds, like, oh my God. And I was like, after like one set, and I was like, I'm done. I was just watching my son work out.
Well, did you do any kind of
I'm not doing this.
trial test or on yourself? Like, this is the way I am before I do the
No,
72 hours. Now it's after. I'm going to get my blood work or something to see if there was a
Or
benefit.
body composition would be the thing you would look at.
Well,
Yeah.
the only thing I did do is I tested my ketosis. I looked at my blood labs before and after. And the craziest thing about it is that people talk about, and they run blood labs. People run blood labs and they talk about you need to do blood labs on a fast. When you do blood labs on a fast, and unfortunately you have to do this for blood glucose, if you fasted 14, 16 hours, I can guarantee you that the blood work on that 14 to 16 hour fast is not going to be the same as that blood work the day before. Mm-hmm. It's not. And I've proven this theory.
Are you talking about gluconeogenesis?
Just like everything, your cholesterol, all of it.
Mm-hmm.
I normally run cholesterol levels, just total cholesterol levels of about 200, just right on that sort of on that board or a little bit high. I think we've talked about this before. Actually, we talked about this a while ago. And if I do a daily blood labs based on my regular diet, just doing it without checking, this is where I run. When I go on a fast, if I fast for over 16 hours, I go pretty quickly because I do intermittent fasting into ketosis. I go relatively quickly into ketosis. I always test ketosis, and my cholesterol normalizes. But granted, if I were to eat on a regular basis and I would do my blood lab in the middle of the day, my cholesterol would be elevated.
So as I look
There's
at
certain
everything I'm
things that-
doing, right? So I've done this stem cells, NK cells. Carrie has me doing a fast. I watch what I eat. I count my calories. I sauna. I cold plunge. And this is the first time in my life, I think my blood work is the best it's ever been.
Yeah, that's true.
Ever.
Yeah.
Right? So
His
it's like,
cholesterol, pre-diabetes markers, incredibly strong, very normal, very healthy.
But ultimately,
it's what
the
you,
biggest change of what you put in your mouth, I bet.
yeah, I mean, it's
Yeah.
a bummer too.
The
'cause-
caloric restriction was a real game changer.
Yeah.
Right,
it is.
right.
It is.
But so wait, now the Carly's here. There's something we just touched on. A word that we just touched on. I want to ask you: can stem cells help you or help somebody with alopecia?
Yeah.
I mean, they can. His kind of stem cells.
Yes. It depends on what type of alopecia. So
Okay.
do they have androgenetic alopecia? I don't know how it's doing with even lichen planus or any of the scarring types. I'm sure it brings down the inflammation around there. But it definitely can help with androgenetic alopecia.
That's the main one that I would say you treat down at ReHealth that I've seen treated.
I think so.
Alopecia treated there.
I have. Yeah,
I
they
didn't know
have. They actually have a really cool little gun
Yeah.
that they shoot
He
like
does,
50 injections into the top of the scalp.
Oh wow!
They'll do cells in the scalp there.
And
yeah.
it just
Cells,
it,
actual
for
cells.
alopecia, you lose all your hair, right? Or is that totalis?
So that's totalis or universalis. But if you're doing androgenetic alopecia, really what's happening is a vascular. The blood vessels are kind of shriveling up, not feeding and giving the nutrients to the follicle. And so the hair is just miniaturizing. It's getting finer and finer. So when you're doing exosomes, like you said, it's signaling right where the body needs to get the nutrition, and it's starting to reverse that. It's just that you have to continue to get that so that it doesn't go back to, because your body is genetic, it wants to go ahead and kill those hairs. So by doing the exosomes, it really allows to boost that hair to grow and start to reverse. But our body's going to want to go after it again, so that's where you have to do something ongoing.
But if you have totalis,
Totalis or universalis,
no one knows
not
it.
going to work. Yeah.
Is that the same process that happens with females when I call it menopause hair? I don't have a better term for it, but the character, the caliber of the hair changes. It becomes more friable as they go through hormone or perimenopause or menopause.
Yeah.
Is that the same process?
So
Similar?
is men's hair loss and female pattern hair loss is really the same disease. And when you look at men, they progress to baldness a lot of times, whereas women just go diffuse. And a lot of times we think, oh, it's menopause or it's stress. But if they have that pattern where it's just the part is getting wider and wider, then we know it's that androgenetic alopecia. So we would treat it the same. Okay. And so we have found that, even postmenopausal, really until we get into our late 70s is when senilus alopecia, just from getting older. But we have a lot of women who are postmenopausal that have a lot of hair. But if you're postmenopausal and you're taking testosterone, then you're creating more DHT,
Androgenic.
which is what's going to affect the hair loss. And that's what we have a lot of problems with, is not that hormones are bad. We want people to be on hormones. You got to get on testosterone, be at an optimal level. But what are we doing if it's breaking down a little bit into that DHT to combat it? Because we'll see men who will lose the majority of their hair in 1 to 2 years because they're at these levels. If they took a pill while they were doing it, we wouldn't have that problem. But in fact, since COVID, the number one Googled procedure is hair loss.
Wow.
Out of Botox, anything, because we've seen such a tremendous amount. And it's not that COVID caused long-term hair loss, but it accelerated that disease, just like we see in cancer patients and everything like that.
You know, you brought up testosterone. How do stem cells work with hormone replacement therapy, testosterone for men and for women? I don't know.
I haven't seen any issues with it. I know many people that do HRT have not had any issues with it, along with stem cells.
Will it work together and help?
Yeah, I mean, I've seen it has. Yeah, zero issues with it.
Well, I think there's synergy between hormone replacement and doing stem cells because hormone replacement doesn't really do much for someone unless they make lifestyle changes.
Everything's a lifestyle change,
And-
you know?
Yeah, I hate
mean,
to
it
say,
is.
but it really does come back to that.
And going back to that, we've actually seen, because we tested many fighters, our concern was you're going to get stem cells, they're going to come back and test you, and then your hormones are elevated or whatever. They said you actually cheated. That's not the case. It doesn't affect your hormones. Our stem cells, the stem cells we've actually done, we haven't seen any changes in hormones.
In all
Meaning
your
hormones levels.
In all
hormone
your
levels.
years of being a doctor and researcher with stem cells, is there anything you've changed your mind on after, like, I believe this, then you saw the numbers and you're like, wow, it's not that?
That's a great question. I've changed my attitude with, I'd probably say in the context of what we talk about, diet and neurological symptoms and a lot of things, because I'm originally from the central nervous system disorders, studying them. And I've somewhat changed the context of aging, of thinking that you can't, it's a process that can't be healed. And it's a process that you're just targeting, brain, when that's completely incorrect. Throughout the years, what I've changed was, for me more than anything else, is the firm belief that if you heal the immune system, you can essentially practically heal everything. If you maintain immune health, that's one. But all of it stems down to the gut.
Wow. Inflammation, what you're eating.
The gut. I always thought about direct, for instance, I originally came from the spinal cord injury sector, where we published a paper in 2008, thinking, we can make these people walk. And then when I realized how complex these injuries are, how complex the central nervous system is, I had to take a step back and say, what can we do and what transpires? Back then it was all this promise of we're going to make people walk again. We're going to do all. It's not that simple.
Wow.
And it's more of a thing of just trying to help a little bit and making the changes. And it's understanding it. Everybody's different. It's really, you both see this on a daily basis with your practices, and you have to be able to flex and think outside the box. You cannot treat one person the same as you treat the other person.
Well, let me ask you this, though. When you talk about inflammation in the gut, are there universal foods that cause inflammation?
Well, I think even to break into this, because we were just talking, the intolerances are a big thing. And so even for our clients, you could be on the best diet, but if you have an intolerance to kale and you're eating that every day because you're on a high, your body's not breaking that down. It takes your immune system, 32 hours to process one bite if you're intolerant to it. So finding out what those intolerances are, what is affecting you, because it's just like we talked about Nutrafol, Viviscal, all these great products. But if you're not lacking any of those nutrients or those supplements, why are we having your system having to process that?
So
How can we get it?
Yeah, we're talking about doing more extensive, out-of-the-box micronutrient testing, looking at your individual profile for the foods you eat and what you're deficient in, and replacing only those necessary.
So it's not like don't eat quinoa, don't eat rice.
No, because that's
Because I always
the
thought that's what it does. I stopped eating all that stuff.
But that's the
Going to Chipotle is a
individuality.
bummer.
Yeah, that's the individuality that we're talking about. You really have to find a good doctor who's going to sit down with you and look at you as an N of one and figure out what is your personal experience.
Yeah, she's
what
my
do I need
doctor.
to do? Yeah,
I like that, the end of one.
N of one.
N of one, yeah. I got it. Like, crazy story is, for instance, you and I went earlier to get a smoothie, and you ordered almond milk. I ordered
Coconut
milk. I don't know if you saw that.
I did.
And let me tell you a crazy story is I had testing done, and the thing that came out was I was allergic. Everything I ate, basically.
Of
'Cause
course,
you build
it happens a lot.
Almonds, avocado. I love avocado. Oh my
Yeah.
god. Vanilla, chocolate, strawberries, and tuna.
That's
So-
what you're allergic to?
That's what came out as I was highly sensitive to.
Okay.
I went back and they tell you eliminate all of it.
Yes.
And the weird thing is during this time frame, I went through this because I wasn't feeling well. I had all these weird neck issues, spine issues, and I eliminated everything. I started feeling good. And one day on a plane flying, I'll never forget, flying to Guadalajara, I was starving. And my first introduction was, what do? You're sitting in business class. They give you the little thing of nuts. And there's
Almonds.
a bunch of almonds. I ate a bunch of almonds, and it's like not even an hour later, my neck hurt me again. And I cut out almonds pretty much out of my diet altogether.
Okay.
And I have not had that issue.
But you got a strawberry shake.
Huh?
You said
But
strawberries.
I got a strawberry.
Today you got a strawberry
Well,
shake.
no, I didn't get strawberry. I told them not to give me strawberry. But then I ended up introducing things slowly, and I stopped taking almonds again, and I introduced avocados again. I was fine. I noticed I am sensitive to tuna, even though every once in a while I'll still eat it. But every time I noticed when I would go back to try to have almonds, that everybody thinks almonds are healthy.
Right.
It's just not
Well,
healthy
almonds
for me.
are healthy,
Yeah.
but not
yeah,
for
but they're not
you.
for me. Yeah,
Right.
not for me. Exactly. That's the
This
difference.
is a whole nother podcast.
Yeah.
Oh, it is? Well, I'm obsessed with inflammation.
It
Like,
is.
I do the inflammation in the photobiomodulation chamber. I'm always doing inflammation. I looked at the foods that cause inflammation. I try to eliminate all of them from my diet.
Yeah.
But but that's a general statement. That's not your inflammation
Right,
panel.
right, I know.
That's a general statement. And the other thing you have to remember about that food sensitivity testing, which I'm a huge fan of, have been for about 15 years when we used it in pro athletes to maximize their performance. And we got their inflammation levels down, they perform better, is it's a moving target. Your immune system pivots and shifts. And I always set them down when they say they want to go down this journey. And I say one thing to them: if your favorite food comes up, are you going to actually be willing to not have it? It's a real question, though, because don't do the test if you're not going to do something about the result. And, not every time does a favorite food come up, but it does a lot. And I say, are you willing to give it up? Not forever, for 6 months. We'll try the elimination strategy and figure it out. But those common foods that you eat, your immune system does tend to create some sort of an inflammatory response or reaction to them. And then I always say the biggest thing to do is when you reintroduce them, you just can't eat. Let's say you ate avocado 3 times a week because you really do love it and it's a healthy fat to have. Let's start having avocado twice a month. You'll be able to keep it in your diet.
Yeah. And that's exactly what we believe, because if you sit there and you eat this all the time, even if you're getting, it once a week, it's going to really affect you. We had a little hockey player who's 12 years old, and he came in and he had huge areas of alopecia just gone. And his family had him on a strict diet. They did everything by the book. He'd gone to doctor after doctor. And when we did a testing on him, he came back and he had high amounts of EMF, but he was very intolerant to whey. And he was getting a protein shake right before his game. And we made just these adjustments and the foods, and the hair came back. And so a lot of times what we tell people is when we're looking at these things, it's about even what nutritionally what you're deficient in. If we can figure out what you're actually needing, getting that through food as organically as possible is going to be the best too. But the EMFs have been a really big one. Radiation, flying a lot, is we're finding Bluetooth. I had an African American woman who had nice hair and she just had almost like a landing strip gone. And we tested her and she was off the scales with Bluetooth. And we said, what are you around? And she's like, well, I wear a piece every single day. A headpiece.
I don't let my kids do that.
Right? Why?
Yeah,
What do you
well,
know?
ear pads, they're saying.
It's bad for you.
All the time. I get so pissed off at both of them. Like, I'm just like, they're like, what? You want me to wear the wired ones? I'm like, yes.
Yes.
The wired
old school.
headphones? The
Yeah,
wired
yeah,
headphones?
no
Yeah.
Bluetooth.
Yeah, I wear wired ones.
Yeah,
Pretty
because
much
it
all the
goes through the
time.
wires and it's not going through the
Jeez,
skull.
man.
Sucks,
that's
but
a whole other podcast probably. Too.
I'm telling you, we have a couple lined up here now. So I think it's.
Go ahead. Sorry.
I was going to say, I think what we've really tried to cover is how for a regular average person who doesn't have the resources of everybody sitting on this couch to find out, how do I get to the real facts on stem cells? How do I get to the real facts? And if you're willing to make the lifestyle changes, if you're willing to do what I call the heavy lifting and the hard work, which means, putting a needle in your arm and giving you stem cells is easy, right? It's the hard part of you have to go back home and make changes in your life, in your sleeping patterns, in your eating patterns, exercise, food choices, all of that. But, they do all those things right. They can pick up the phone and call ReHealth down in Cancun and find out more information.
Yeah, what's ReHealth Instagram? Just ReHealth, right? On Instagram?
I think it's rehealth.com.
Yeah, or ReHealth.
Yeah,
dot
ReHealth.
com. ReHealth.
Yeah, but ultimately everything we discuss here is the context of inflammation. We have a good amount of data also on ulcerative colitis, on Crohn's disease.
That colitis, that's what you call it?
Ulcerative
Yeah,
colitis.
that's what our friend has, right?
Yes, correct.
so we
and
have
we
a
actually know two
great
other
amount of-
friends
that
who've
have it.
gone down there and their disease has gone in remission after their stem cells.
Yeah,
Man, I'm telling you.
Amazing.
and when you heal this, you heal this too. It's you heal the brain
I think you guys are amazing.
quite a bit.
We're so grateful that you came here today, Rafael.
Thank you
Dr.
guys for
Gonzalez.
having me.
But so wait,
Pleasure.
what about you can't get Juvo
Professional
unless you're a doctor.
distribution
Definitely
only.
They can, yeah. They can go on to juvexo.com and look at who provides it.
What about you, Carly? National Hair Loss. I said National Hair Loss Institute, but we're
It's
walking
just
out.
national hair loss, but we have it as medical aesthetics.
Oh, medical.
'Cause-
That's what the
yeah.
MA is.
Yeah.
But so what's the website?
National,
Just national?
NHLMA.com.
Okay. And Benacer?
And Benacer.com.
Benacer.com. All right, good. So it's a good podcast, right? Was this good?
Fantastic.
Did you like it? Did you like it?
Yep,
Now we do at
absolutely.
the end of the podcast is critique the podcast. Like, how was it? Was it good? Was it good?
I just have a question real quick. And you might have already talked about this, about Parkinson's.
We did not touch base on Parkinson's.
We
We didn't
didn't.
touch base on Parkinson's. We didn't, but what we have seen is improvement in gait. Individuals that do it, improvement in gait, and in individuals, improvement in writing ability, because there's less tremor. That's the only thing that we've seen. We've actually we've treated a couple people that have come back probably like every year and a half to get treated, because essentially they progress back. A lot of these, I don't know if you've seen actually there's some cases of fecal transplant that have even helped too.
What
So
transplant?
changing fecal transplant,
Fecal?
changing the microbiome
Fecal?
in Parkinson's, yeah.
Well, they do
FMT.
fecal transplant in a disease called C. diff.
That's
it's
approved for that.
Yeah, and it's approved for that, and that's been kind of a common treatment for failed pharmacological treatment. But I have not seen it in Parkinson's. No.
Yeah. Well,
What
they've
about,
done it experimentally, and they've seen
Saunas. Don't saunas help with Parkinson's? Infrared saunas?
I would probably, I don't know, but I would probably say no, because the problem with what I've seen straight across the board with people with neurodegenerative, Alzheimer's, Parkinson's, the majority of them are completely dehydrated.
Oh,
And I don't know if
Very
they're not
true.
absorbing nutrients. I think if they're not absorbing
I
nutrients the correct
I
way.
agree with you from managing some of those cases. It is a malabsorption problem, 100%.
Yeah. They're not, you give them, it's crazy. You give them an IV, and I've seen this, a simple Myers or whatever.
But if they drink
and
water, they're dehydrated.
and
they
even
can
correct.
drink ample water, and it doesn't matter.
and they're not getting it
I'll take it
correctly.
one step further. If you actually infuse water or nutrition into a G tube, so we bypass the drive for thirst or whatever and put it into the gut, it still doesn't get absorbed, but IV does. So I think you're onto something there.
So then would you want to do an IV every day if you have Parkinson's?
I think ultimately if you have the resources,
Right.
and very few people will, to have the right kind of line installed and to have a nurse available to do that, that would be ideal. But that's probably not reality.
But have you seen like severe cases of Parkinson's? You said you give them the IV and or is
No,
that just...
that depends. If somebody is catatonic, no. Catatonic, basically, they're frozen. No, you're not going to basically cause anything. Those individuals, now what's known straight across the board with neurodegenerative disorders is every single one of them have a blood-brain barrier or a blood-spinal barrier compromise. Meaning everything from the outside system has actually gone in and caused issues. The brain and the spinal cord does not heal itself like the rest of the body. And the individual that is able to stop that compromise and give it a better chance at what's called plasticity is going to win a Nobel Prize. Which I think the key to that is probably replenishment, believe it or not. My theory is endothelial cells is something that would work well. which is a different cell type in the body.
Are they going to patch the
Which would possibly
blood-brain barrier?
Yeah, it would possibly
Act as a patch?
the blood-brain barrier.
Uh-huh.
Yeah, to seal it. As you age, if you've gone through trauma, for instance, you look at football players.
CTE.
Concussion. Yeah, those individuals have a compromise of the blood-spinal barrier, the blood-brain barrier, and the immune system is now compromised. This is what I actually studied in my PhD thesis, is following spinal cord injury, the compromise of the immune system into the central nervous system, into the brain, the spinal cord. And there's a significant amount of evidence that these pro-inflammatory cells go in there, they wipe tissue out, and then the brain can't heal or the spinal cord can't heal. So you now have an area that's void of tissue, of
So
regeneration,
you get
of
Swiss
anything.
cheese.
Yep.
Yeah.
And you get no healing. If you can stop that compromise, you shouldn't have that issue as bad.
No help with stem cells? No improvement, nothing?
Not sealing the blood-brain barrier as far as I know. And I think that's another reason why, for instance, you give these individuals an IV because it's crossing and it helps. And it's not going to cross maybe when they try to absorb it through the gut, they're drinking water. It's a question that I don't know. I wish we can figure that out.
So Carly, I asked her to come here because I wanted you guys to meet, or all of you guys. But now, because I know you listened to some of the stuff about the actual stem cells in Cancun, the stuff that we were doing there. Does any of
Which
that?
we're coming. But
does
I'm really excited about really is I have a family member who just was actually in 1 week, 2 family members that were just diagnosed with Parkinson's, really because of their symptoms, and they're doing all of these tests, going to Hoag and going all over. And to me, if we're looking at this, I think doing stem cells, while they're not really bad,
Early stages.
the early stages where
is the
they're just
best
getting
approach.
that, this could be really, really huge. Because I'm
Yeah.
hearing this more and more where people are like, we haven't figured it out for sure if it's Parkinson's, but all of your symptoms are relating to this. That would be right when we want to get
We're-
down there.
yeah.
Well,
Yes.
and I always say
Yep.
too, because even if, let's say that it doesn't have a targeted approach on Parkinson's, there's probably other comorbidities going on in their world, which are yet taking the resources of their body that would normally be used to fight the Parkinson's,
Right.
and they're pulling them off, right?
Right.
So if the stem cells can kind of repair those things and get their inflammation generalized down in their body, I think
push
they
off
have
the
a better fighting chance.
Yeah.
To
It's
know,
exciting.
to
I mean, I
what is-
love it. I think you can see it's changing people's lives. I mean, I'm just looking at it cosmetically, what it's done for people. I mean, our hair is what makes us feel, like ourselves, and our skin, and to know what it's doing for the body is really exciting. And I'm excited to get down there. I'm going to have you do my foot first.
What's wrong with your
Have them
foot?
do it.
Oh, because you banged it, you fell?
I was
because she
almost-
couldn't feel it
I was like
10 minutes ago.
I couldn't feel my
Can't feel my
foot.
foot.
I was just making an entrance.
Oh, that was hilarious. All right. Well, thank you guys. It was a good podcast, right? Well, let's go, Doc. That's
Yes.
Okay, so welcome to our podcast. This is a little bit different today because this podcast is a spin-off of our radio show.